Hello, everyone. The topic which will be covered today is epidemiology of periodontal diseases. These are the contents of the lecture. So, periodontal diseases is basically caused by uh, one which attacks the supporting structures of the teeth, and gingivitis is the initial stage of inflammation of gingiva, which, if not treated, turn into periodontitis involving the periodontal tissues. The epidemiology is derived from the Greek word epidemic, and the definition was given by John M. Last. It is defined as the study of distribution and determinants of health-related states or events in specified population, and the application of the study to the control of health problems. Uses of epidemiology is to study historically rise and fall of diseases, to diagnose community problems of the health and diseases by study and analysis of incidence, prevalence, and morbidity, to estimate individuals' risk and chances of developing diseases, to help complete the clinical picture and natural history of disease by group analysis, to identify clinical syndrome by observation of group behavior, to evaluate need and effectiveness of health services, to search for causes of diseases and health by observation of group habits, customs, and models of life. Work upon it has been retarded by a number of factors: greater incidence late in life, difficulty in objective measurement, gingivitis subjective and weak, pocket depth is an observational error, and alveolar bone loss cannot be evaluated clinically. In the world, it has been seen that gingivitis at a population level is found in early childhood, is more prevalent and severe in adolescent than level of, and in children and adults, it is seen that in the US, 82% of the adolescents were gingivitis and signs of gingival bleeding. 75% of the adults, gingival bleeding, dental calculus, and poor oral hygiene has been observed, similar in other parts of the world. Chronic periodontitis is a non-aggressive form of periodontitis, most prevalent among adults and seniors. Children and adolescents has a wide range of frequency in various geographic regions and ratio ethnic groups. Relatively high frequencies in Africa and Latin America, and low disease frequency in young Caucasians in Western Europe and North America. Here's the triangle which shows epidemiological trait, which shows that disease cannot occur until these three factors come into role play, that is the environment, host, and agent. Then under environment, host factors, these are the factors which are covered, like age, sex, race, genetics, intraoral variation, endocrine changes, local host factors, occupational habits, concomitant disease, emotional disturbance. Under age and bacteria, black calculus, chemical and physical hazards are included. Under environmental comes geographical areas, nutrition, fluoride, degree of urbanization, education, social factors, cultural factors, professional dental care. If we discuss them separately, the host factor will comes under first is the age, which comes under the host factor, where at population level it is found that early childhood is more prevalent in severe adolescence. In gender, males have higher prevalence and severity of periodontal diseases than females. Income shows that periodontal disease is inversely related to increasing level of incomes. Education, periodontal disease is inversely related to increasing levels of education, and the prevalence and severity of periodontal disease are lower in office personnel than in factory workers. Physiological and cultural factors shows that anxiety, fear of dentists, lack of knowledge about their disease and treatment are some of the relevant psychological factors. Diet and nutrition shows that the nutrients that have been associated with periodontal tissues are vitamin A, B complex, C, D, and calcium. Vitamin A deficiency is well known to predispose to periodontal disease. For example, a group of pregnant women showed that mixed maximum inflammatory changes in the periodontium in the 8th month was observed when the mean physiological level of vitamin A declined. Vitamin C deficiency has been shown histologically to result in a lack of collagen formation. Vitamin D has been found to have anti-inflammatory effects and may reduce susceptibility of the health to chronic diseases. Oral hygiene practices shows that study in India have shown that less than 1/3 of the Indian population use toothbrush and toothpaste to clean their teeth. More than 50% of Those who use a toothbrush are not aware of the brushing techniques, and other oral hygienes like dental floss and mouthwashes are not widely available and are rarely used in India. Under the agent factors comes the plaque, material alba, and calculus. The plaque has the soft deposits that form the biofilm adhering to the tooth surface. A white soft deposit is the material alba occurring around the neck of the teeth. Calculus is the hard deposit that forms a mineralization of the dental plaque. Supragingival calculus and subgingival calculus is divided into two, that is supragingival and subgingival. Supragingival is found above the gingival margins, and calcified deposits found on the root surface of the periodontal pocket. Coming on to the chemical and physical hazards, mercury, lead, thallium are one of the most common factors for causing gingivitis and periodontitis. Radium and other sources of ionizing factors are also responsible for loosening of teeth. Then the medications. Under the environmental factors comes the physiogenic and radiation hazards. The physiogenic factors shows the emotionally disturbed patients, and radiation hazard shows the one of the environmental factors. Geographical areas, certain geographic areas in the world are associated with more periodontal diseases than other. It is yet not possible to analyze what sub-factors contribute to these geographical variations. India rates among one of the countries have the highest prevalence of periodontal disease. Diet and oral hygiene practices are also one of the major environmental factors. Here are the references showing the book to be concerned. Thank you.